And now it's my pleasure to introduce Dr. Vera Beca from Albania, who will be presenting circulating inflammatory mediators in COVID-19 affected pregnancy, a retrospective evaluation of D-dimer, ferritin, and CRP dynamics.
My presentation is about some circulating inflammatory mediators in COVID-19 affected pregnancies. This is a retrospective evaluation of the dimer, ferritin, and CRP dynamics. In the period of COVID-19, I was in a medical team that was responsible to take care for pregnant women which were positive for COVID-19. And this study includes background, aim of the study, material and methods, results, conclusion, and clinical implication. The COVID-19 pandemic, caused by a highly infectious coronavirus, poses a serious public health threat, with pregnant women and their fetuses and increased risk of severe illnesses. In the guidelines for the clinical management of pregnant women with COVID-19, the WHO recommended that pregnant women with moderate or severe disease should be monitored via laboratory and imaging tests. CPR, D-dimer, and ferritin. C-reactive protein is a sensitive marker of a systemic inflammation. During the pregnancy, slight elevation may be seen, but in COVID-19, markedly increased SRP levels are associated with disease severity and can help monitor infection progression. D-dimer is a marker of blood clot formation and breakdown. In pregnancy, the dimer levels naturally rise due to physiologic changes in the coagulation system. In COVID-19, extremely elevated levels may indicate thrombotic complications such as pulmonary embolism, which pregnant women are already at high risk for. About ferritin reflects the body's iron stores and acts as an acute phase reactant. In pregnancy, moderate changes can occur, especially due to iron needs. In COVID-19, high ferritin levels signal a severe inflammatory response or cytokine storm, potentially complicating both maternal and fetal outcomes. To evaluate the levels of the dimer, C-reactive protein, and ferritin in pregnant women hospitalized with COVID-19 and to assess their correlation with disease severity and clinical outcomes. CRP, a sensitive indicator of inflammation. Sharp increases suggest worsening COVID-19, predicting complications like pneumonia, preterm birth, or ICU admission. The dimer naturally elevated in pregnancy, but very high levels in COVID-19 may signal clotting risk like thrombosis or placental issues, helping predict ICU needs. Ferritin, that is an inflammatory marker, high levels may indicate cytokine storm or severe disease linked to poor maternal or fetal outcomes. This study is a retrospective observational study. The period that we have took the samples are January 2020 until December 2021. Main referral hospitals, including Queen Geraldine High Risk Maternity Center. We have included 83 pregnant women and confirmed SARS-CoV-2 infection confirmed via RT-PCR method. Inclusion criteria: we have included only COVID-19 related complication, example respiratory distress, preeclampsia, complete clinical and obstetrical outcomes. These are some normal references level of the three biomarkers, both in non-pregnant and pregnant women. In non-pregnant adults, woman is less than 0.5 microgram per milliliter. In pregnancy, the first semester is less than 15 nanogram per milliliter. In the second semester, it's less than 1,000 nanogram per milliliter, and the third trimester, it's 1,050 to 1,500 nanogram per milliliters. We have to say that the exact values may vary by lab. Levels normally rise in pregnancy. Ferritin in non-pregnant adults is about range 15 to 150 nanogram per milliliters, typically lower due to increased iron demands of 10 to 100 nanogram per milliliter. Elevation in COVID may exceed 300 to 500 nanogram per milliliter in severe cases. C-reactant protein in normal range is less than 5 to 10 milligram per milliliters. In pregnancy may rise slightly, but usually stays less than 15 milligram per milliliter. In COVID-19, levels can exceed to 50 to 100 in moderate severe diseases. This is CRP reaction, C reaction protein. Levels increase sharp, and as you can see in a graphic, this is a increased level sharply with higher severity scores near level 3, reaching up to 250 until 300 milligram per milliliters. 0 is equals to asymptomatic COVID-19 gravity. 1 does it mean mild symptoms or mild form of COVID-19 in gravity. 2 does it mean moderate form, and 3 is severe form of disease. To interpret this graphic, we can say it is a strong inflammatory response in severe cases. The dimer observation, widespread with some extreme values up to 12,000 nanogram per milliliter in higher severity groups, group number 3. Elevated D-dimer in more severe patients, indicating coagulopathy risks. And here is a graphic for ferritin. Ferritin levels cluster more tightly, but still show increasing values with higher severity, especially around 200 to 300 nanogram per milliliter in level. In this graphic suggests inflammatory and metabolic stress in severe cases. This is some data from our lab, and in median of the dimer is 937.5 nanogram per milliliter. IQR is 1636.2 nanogram per milliliter, high availability, and for all of these are for 22 patients. In our statistic, p-value was 0.0294, statistically significant, because for the D-dimer, p to be statistically significant is less than 0.05. So we have elevated D-dimer is significantly associated with COVID-19 severity in pregnancy. About ferritin, the p-value for 76 patients is less than 0.0001. That doesn't mean highly significant. Ferritin is strongly associated with disease severity or inflammatory response in pregnant COVID-19 for the patients that are positive for COVID-19. I have to say that for 6 patients, it was not ferritin data. Timing of measurement. For CRP levels may have been measured early in the disease courses before peak inflammation developed. To know the CRP has increased levels in inflammation when we have developed inflammation. CRP typically arises later in the inflammatory response, so early sampling could underestimate its association with severity. Sample size limitation. The CRP analysis included only 76 cases, which may be insufficient to detect a small to moderate effect. Larger sample sizes increases statistical power and likelihood of detecting significant differences. High variability, IQR, it was equal 71.2 milligram per liter. The wide interquartile range suggests high variability among patients. This variability may dilute the apparent effect and reduce statistical significance. As a conclusion, ferritin showed the strongest correlation with severity, with p less than 0.0001, and may serve as a powerful prognostic biomarker. The dimer also showed significance association, indicating a role in predicting complication like clotting. CRP, while elevated, was not statistically significant in this dataset, though it may still be clinically relevant. Clinical implication. Integration of biomarker screening on hospital admission may enhance patient management. CRP, ferritin, and D-dimer should be considered in triage protocols for pregnant COVID-19 patients. I want to thank you all the organizers